Hello, my name is Adam Mikolajczyk, and in this episode of the Transplant Fact or Fiction series, we will be discussing the risks of hepatitis B, hepatitis C, and HIV infections from donors. Fact or fiction? If my transplant center informs me that a potential donor has risk criteria for a recent hepatitis B, hepatitis C, or HIV infection, then I should not accept the organ. This is fiction, and for the next several minutes I will explain why. But before we begin, it is important to understand some of these risk criteria. Some examples are donors who inject non-medical drugs or are sex workers, donors who have had sex with a person who is known or suspected to have HIV or hepatitis B or C, donors who have had sex with a person who injects non-medical drugs, and donors who have been incarcerated for greater than 3 days. I know, it is a little worrying to read this list, but let's talk about the following facts, which will make this all much less scary. First, it is important to remember that all donors have a chance of being infected with HIV, hepatitis B, or hepatitis C. So even donors that are not at risk for a recent exposure still can be infected with these viruses, as a donor's behavior may not be noted in the medical chart or entirely known to family or friends who may be providing the patient's background. Fact number 2. All organ donors are checked for infection with HIV, hepatitis B, and hepatitis C with very accurate tests before donation. Thus, just because a donor has risk criteria for a recent HIV, hepatitis B, or hepatitis C infection does not mean the organ is actually infected. It just means that even though the tests were negative for these viruses, there remains a very small chance that the organ could still be infected by one of them solely based upon the donor's risky behaviors before the donor's death. So how small is this risk? Well, there's actually a higher risk of dying in a car accident, 0.9 out of 100 persons, than there is to become infected with HIV or hepatitis C from a donor with risk criteria, 0.4 out of 100 persons. Sadly, because of the rate of opioid overdoses in the United States, organs from donors with risk criteria tend to be from younger donors, which are usually of better quality. This may explain why the outcomes of organ transplants from donors with risk criteria are equal to those from donors without these risk criteria. Next, it is important to remember that if you decline to accept an organ from a donor with risk criteria, you cannot predict how long you will have to wait until you receive another organ offer. And there is always a chance that you then become too sick or too frail to receive an organ transplant by that time. Thus, holding out to receive an offer from another donor could be a risky strategy. Finally, it is important to know that all patients are watched very closely after transplant to make sure no transmission of HIV, hepatitis B, or hepatitis C has occurred. And if in the rarest of chances getting a virus from the donor does occur, then it can be well controlled with medications. We now have several treatments that cure hepatitis C and many medications that can effectively suppress HIV or hepatitis B for a lifetime. So, in closing, do not let discussions about a donor with risk criteria for a recent hepatitis B, hepatitis C, or HIV infection frighten you. The risks of infections from organs from these generous donors are extremely low, and the rewards are very high. Thank you.